from the University of California in San Francisco. Welcome, Dr. Nguyen.
Thank you. Good morning. Thank you for having me on, and thank you to all the audience for working to inform our diverse communities, particularly in their own languages. I do want to start with a summary of the COVID vaccine situation. As Secretary Richardson has mentioned, the FDA has approved 3 vaccines that work to prevent COVID. We'll just use the name Pfizer, Moderna, and Johnson & Johnson. All 3 are effective and safe. As a doctor and a health researcher, I can tell you that the data on these vaccines are just incredible in terms of their high level of effectiveness and low rates of complications. For the people on the front line, like us at UCSF, a new effective vaccine like Johnson & Johnson just means more vaccines to go around so that all of our patients can get vaccinated sooner. People ask, what's the best vaccine? The best vaccine, the best COVID vaccine is the one you can get as soon as possible. I know people are asking this, and I sort of answer it by saying it's a little like asking which of my 3 children are better. They are all great. One note about the science on this, each of the vaccine was compared to placebo, and the vaccines were not compared against each other, which is the only way to be sure to know which one is better. Each of the study was designed differently with different outcomes. So when you see the efficacy rate for each of the vaccine, they're not directly comparable. But here's the main thing. Before the pandemic, we all thought that the flu vaccine was great. And a typically great flu vaccine has an efficacy rate of around 50 to 60%. Each of the 3 COVID vaccines did better than that in preventing COVID disease.
We're going to leave in about, so she's right here.
Each of the 3 COVID vaccines did better than that in preventing the COVID disease. The efficacy rate is about 70 to 95%. What's even more important, all 3 are even better against severe COVID outcomes, like going to the hospital, going to the intensive care unit, or deaths. And in the studies, as well as since approval, the vaccines are very safe. With millions of doses given and millions of people already vaccinated, we already know a lot more about the side effect of these vaccines than many of the very safe medicines that we are getting prescribed by our doctors for routine health problems. The most common problems in terms of the vaccine are sore arm, aches, fatigue, or fever, but these are not harmful, and they last anywhere from a few hours to a couple of days. After the first 14 million doses of the Pfizer and Moderna vaccines were given, not a single death could be attributed to them. While the Johnson & Johnson vaccine uses a different technology than Pfizer and Moderna, I want to emphasize that none of the vaccine can give us COVID. The vaccines basically present a small part of the virus to our body so that our defense system can prepare a response, so that when the real virus shows up, our defense system recognizes it and removes it. The analogy I use is like us using fingerprints to recognize criminals. Having the fingerprint in your house is not the same as having the criminal in your house. And for those who are not sure whether or not they should get the vaccine, I want to ask them to consider the following. Millions have already died from COVID. It is very infectious. Do you want to risk getting COVID and dying from it? Do you want to risk giving it to the people you love and watch them die? Many people who got COVID and did not die still have ongoing health issues related to COVID. We don't even know what the long-term health problems are with COVID. Do you want to take the chance of having long-term disability from COVID? That's why I think, and all medical professionals think, that everyone who is eligible for the vaccine should get it, even those who are already infected with COVID, because the natural defense to COVID may not be enough to prevent another infection. Of course, we do say and recommend that everyone, including those already vaccinated, should keep on wearing masks, washing their hands, and practicing social distancing until we can bring an end to the pandemic. We need to continue wearing masks because we still need to study whether or not the vaccine can stop the spread of the virus, and while we study how well the vaccines deal with the new variants of the virus. So I'll finish up by saying that I and all medical professionals encourage all Californians to get vaccinated when it is their turn, and keep wearing your mask. Protect yourself, your family, your neighbors, your coworkers, and everyone around you. Get the vaccine. Thank you.
Thank you, Dr. Nguyen. That was excellent. Thank you.